Ever thought about what brings about the infamous influenza? It's a question that has puzzled many, and today, we're diving into the depths of this highly contagious viral infection that often makes its rounds during the chill of winter months. Influenza, often referred to as the flu, is a crafty culprit. It's instigated by not one but three villains, the influenza A, B, and C viruses. Among these, influenza A is a master of disguise, constantly changing its form. It has various subtypes which are classified based on their surface antigens, hemagglutinin and neuraminidase, or in simpler terms, H and N. These viruses are shapeshifters, frequently mutating and giving rise to new subtypes and strains. This constant transformation is one of the reasons why it's so tricky to pin down, and why a yearly flu shot is recommended. Now, how does one know when the flu has struck? The symptoms can strike suddenly and with force. It typically starts with a high fever, accompanied by a headache, muscular aches, joint pains, a dry cough, and a general sense of fatigue or malaise can also follow. In most cases, the telltale signs are enough to diagnose influenza. However, sometimes PCR testing is used to confirm the diagnosis. Usually these symptoms are self-limiting, meaning they tend to resolve on their own with time and supportive care. But when the going gets tough, antiviral therapy steps in. This is especially considered for patients with an early or severe onset of the disease, and particularly for those with a high risk of complications. Antiviral therapy can help reduce the severity and duration of symptoms, and also lower the risk of developing complications. In rare cases, influenza can lead to secondary bacterial pneumonia, most commonly caused by Staphylococcus aureus or Streptococcus pneumonia. This is why it's so important to take influenza seriously and not to brush it off as just another cold. So how can we arm ourselves against this invisible enemy? 3 words: hygiene and vaccination. Washing hands regularly, practicing good respiratory hygiene, and getting vaccinated can significantly reduce the risk of catching and spreading the flu. Influenza is a formidable foe, but with the right knowledge and precautions, it's a battle we can win. So, stay informed, stay prepared, and most importantly, stay healthy.